Thank you. Sabrina did an outstanding job being very eloquent about what the bill does do. And what I'd like to spend some time talking about is the accusations of what the bill does and explain why that's not what the bill does. So there are many people who are concerned that by passing the Reproductive Health Act, in some way it would require all hospitals, whether they are from religious backgrounds or non-secular hospitals, to provide abortion services that may be against their own religious beliefs. The bill is very clear that it upholds all existing conscience clauses that are in the state and federal laws. And certainly there's nothing that the state legislature could do to override federal requirements. And the federal law is very clear on requiring conscience clauses for Catholic hospitals to not be required, or other hospitals that may have an issue with the full range of reproductive health care services. A state cannot impose that. That will not happen. Additionally, providers will not be penalized if they chose to exercise a conscience clause or be discriminated against by the state of New York. That would not be something that this bill could actually accomplish. There are folks who are concerned that New York State would no longer be able to regulate the abortion services. Again, the state would still hold all regulatory authority over all health care provisions, including abortion services, if we were to move our abortion care from the penal code to the public health law. And actually, it would probably provide a better, more streamlined way to provide regulation and guidance for medical providers. So once again, there would be no way that the state would be limited on regulating abortion care or services. What this does do is ensures that the full range of the Roe versus Wade decision, which included a health exception, which through the Supreme Court has been said to be required to be read into state laws, would in fact be very soundly and affirmatively stated in New York state laws. And why is it that we want that? Sabrina talked to you about how 7 out of 10 New Yorkers are supportive of this bill, and the reason they're supportive of it is they truly do believe that the provisions of Roe versus Wade are under attack in this country, and there might be change, and very likely would be change, if the Supreme Court were to look at it again, or that this particular Congress might take action that in fact would change access to the full range of reproductive health care services. And so what we want to ensure is that here in New York, medical providers can provide the care more fully, but certainly the care they provide today, tomorrow, regardless of what happens at the federal level. And it's a common sense provision that New Yorkers are asking for. It's very rare that we get an issue that on a federal level has divisive qualities like this, that you would get 70% approval. The bill is as popular as the governor. So it seems to be very clear where legislators should come down on it. We appreciate very much the support that we have of the Senate, in the Senate, and across the state on the bill, and we thank you for raising attention to it. This bill is timely, it's appropriate, it keeps New York State at the forefront of leading the way on women's health care, but it doesn't put us at the front. And no one should be confused to think that New York State would be the first to pass a bill such as this. There are already 6 other bills passed very similar to this across the state, and they were done years ago. So we're not doing anything that is extreme or overwhelming, but what we are doing is, in this climate, when women's health care is being used as a political tool, is saying in New York State, it is not about politics. It's about the health of the women and access to care, that we are going to ensure that we have modernized laws that are located in the public health law by taking a very common sense bill and moving it forward. And we're happy to answer any questions that you have with regard to the bill.
Thank you.